Most of us try to swing by our doctor's office at least once a year for our annual physical. You know the routine, the doctor weighs you, checks your temperature, asks you a whole lot of questions while they're typing. And today it is President Trump's turn. And by the way, there's no hard and fast rule that the president has to share the results. At the end of the day, President Trump has the final say on what, if anything, he shares with the American public. Throughout history, sitting presidents have actually kept numerous health concerns private. For example, Lyndon Johnson didn't disclose his skin cancer diagnosis. FDR hid his heart condition and the extent of his disability from polio. And John F. Kennedy kept multiple health problems secret from the public, including serious back problems and Addison's disease. So here to help us better understand how we should interpret a presidential physical is CBS News medical contributor, Dr. Céline Gounder. She is also editor-at-large for public health at KFF Health News. Dr. Gounder, thank you for being here. So does a physical exam that a president gets in this annual physical differ from what we all get when we go to the doctor?
Yeah, presidential physical is not your typical physical exam. I think it makes more sense to think about this as a curated medical PR event, really intended to reassure the public that the president is able to perform his duties.
So what are they looking for? What are the basic things they're at least doing?
Yeah, so the basic things they're going to be doing are vital signs, your heart, lung, abdominal exam that you're used to getting at the doctor's office, basic labs like your cholesterol, your blood sugar, maybe kidney and liver tests. And then if there is a prior medical history of a risk factor or some other issue, maybe an EKG, a chest x-ray, ultrasound, echocardiogram, that sort of thing.
I remember when the president was in office last time, there was like a press conference or something like that where he talked about the results and his doctor came out. Was he always upfront about the results all 4 years?
It's been variable. So we've gotten much more in terms of his history in earlier releases. So 2016, for example, during that campaign, his doctor famously had the letter of his health dictated to him.
Right.
In more recent years, there's been a lot less detail released, but he's not under any obligation legally to be providing full records.
He's our oldest sitting president now. Does that play a role in any of this, or should it?
Well, we know, right? As you get older, your cognitive faculties decline. You're not going to be as quick and sharp as you used to be. In fact, former President George W. Bush has said that he's younger than both former President Biden and Trump, and that he's too old for the job now. But there is no formal cognitive evaluation or mental health evaluation as part of this. And we know that as you get older, those are some of the things that really matter most.
All right, Dr. Gounder, thank you so much.